Excellent. So good afternoon, everyone. Thank you for taking your lunch break to listen to my talk this afternoon. I have slightly changed the title to hopefully make it a little bit more relative to our everyday lives. Unfortunately, death is something that is not the nicest topic to talk about, but it is something, it's such a universal experience that we will all experience either to ourselves or loved ones around us. And it's a topic that we don't often talk about. But I'm hopefully going to shine a light on that from a real sort of data perspective, and sort of give more insight into what actually happens to our data when we die. So to begin, I wanted to share a little bit about my background to provide context. So my research and my areas of research sort of cover these three main domains. Unfortunately, not the nicest domains, but pain, death, and now data. And my journey started into research and creating the tracker started in pain. I'm an epidemiologist that was interested in understanding how we prescribe strong pain medications called opioids. And I started that work when I was back in Australia, the sort of very start of my career about 12 years ago. So I became really interested in why we were prescribing these strong pain medicines for long-term conditions. And this was before there was any Netflix series out there about opioids. But I'm really excited to see that this is a topic that we're now able to talk about. And it's really giving a voice to those people that have a silent condition, which is really difficult to diagnose and treat. Focusing on the area of opioids, I came over to the UK in 2017 to do my PhD at the University of Oxford, and that was to explore how we were using opioids and the harms of opioids from a data perspective. That's sort of where I became interested in understanding our sort of most concerning harm. So usually in medicines, we're interested in what we call adverse reactions or adverse events, which is side effects from medicines. But the most simple, from a data perspective, the most simple harm to explore is death. So I thought this would be a really easy aspect for me to start exploring towards the end of my PhD of how we could try and prevent deaths involving opioids. But I'll come to show you why it's so complicated to get really accurate data on the number of deaths that occur every year in all countries across the world. And the sort of data that I'm interested in terms of death data is inquest data. So these are deaths which I'll explain a little bit more about. But in healthcare generally and in public health, in epidemiology, we most of all focus on either national statistics, so you can get those from, say, in the UK, the Office of National Statistics, or electronic health records. But electronic health records and national statistics don't provide the insight into what actually occurs in the lead up to deaths. And that's all the information that gets disclosed during inquests. The inquest system and the coronial system is a very ancient system. It's the oldest system that we still have today from the medieval times. And so the concept of data and a sort of medieval based system is being the real challenges that I've been facing. And I'm trying to build something in a system that is hundreds and hundreds and hundreds of years old. But so that's sort of my background and how I got interested in the sort of areas that I work in terms of research at Oxford. But today, what I hope to sort of share with you, and I hope that you'll take away from today, is sort of how we can learn lessons from deaths. And unfortunately, it's just looking at England and Wales, but I will shine a light on the systems that we have in Australia as well. Then sort of what is a Preventable Deaths Tracker, how it was built. And then an interesting thing that I think everyone doesn't know much about is what actually happens to our data when we die and why this information is publicly available. So putting this into perspective of all deaths, I think it's useful to sort of know these numbers. And I know this is sort of a community of most likely data scientists or people that work in data. So every year in England and Wales, we've been sitting around the 600,000 mark. So 500,000 deaths occur every year. Specifically in 2023, there was nearly 600,000, so 581,000 deaths were registered in 2023. Now, that's not the number of deaths that actually occurred, but I won't go into the nuances around that today. And then what we have is the death that I certainly hope that I have one day, is what we deem a natural death. So these deaths, when these deaths occur, it's where the cause of death can be determined. And this occurs in about 66% or 2/3 of all deaths. So when a death occurs and the clinician on duty can actually write what the causes of death were and sign the death certificate, these deaths are not required for further investigation. In England and Wales, there is a new system called the National Medical Examiner System, which will start to investigate some of these deaths, but I won't go into the nuances of that. Then we have the other type of deaths, which are those that require a form of death investigation. And these are most likely or usually because they're reported to the coroner because the cause of death cannot be determined. And that's often because it's been an unnatural death, it's been an unexpected death, a sudden death, or a violent death. So often in children, suicide, car accidents, falls, any sort of medicine, illicit drug use, any sort of death that we don't expect to occur, or there needs to be an investigation into why this death has occurred. So as of last year, the data from last year has just been published last week, and that shows us that it was just under 200,000 deaths that were referred to a coroner, which represents 34% of all deaths. Then the coroner will sort of gather, the coroner and the coroner's office will gather lots of information about what happened in the lead up to the death. And if they can still no longer determine the cause of death, they will have a public inquest where all the different bodies and people, interested persons that were involved in the death will be sort of come together and an inquest will be held. So last year, nearly 37,000 of these inquests were held, which represents 6% of all deaths. And then in England and Wales, there is a system or there is a regulation where during the inquest, either before, during, or after the inquest, the coroner has a duty to write a report called a PFD, or called a Prevention of Future Death Report. And they must write that report and send it to organizations to sort of take action to prevent this death from occurring. Now, this is a unique system to England and Wales. It doesn't happen in Scotland. It doesn't happen in Australia or sort of the other jurisdictions. It's quite a unique aspect to the English and Welsh system. So the coroner will write this report. They send it to any organization who they deem has the power to take action. That organization who receives the report from the coroner has a legal obligation to respond within 56 days. Once the coroner has received the response, they will send that response and the report directly to the chief coroner's office. So in England and Wales has the single chief coroner and the chief coroner's office that supports the chief coroner. And the chief coroner's office is tasked with publishing that information publicly onto a website. So my question as an epidemiologist when I started coming from Australia was, okay, well, how many deaths have been prevented from this big complex system that I'm painting here? So we have these reports being written by local coroners, they get sent to organizations, and surely there is some sort of feedback mechanism to ensure that we're learning from these deaths. So just for context, this is what the websites looked like. So the sort of first one from July, this data has been available since July 2013. It used to look like that old website up until the end of 2022. And they did do a sort of remake, but that old website is what I started working on 5 years ago when I was collecting this information. So it was very, very difficult to sort of use this website. Then at the end of 2022, they published a new website, which then allowed you could sort of start to search the website and to do a little bit more data collection, but not in the way that we need for a robust research project. And this is exactly why I created the Preventable Deaths Tracker, and I'll share more about what that is. The sort of exciting thing about the Preventable Deaths Tracker is there was no data that existed on the number of reports, how many were being published. The chief coroner's office, individual coroners, the government had no idea on the volume of reports that were being published every year. So now with the tracker, we're able to determine, we can know just looking at this data, in 2023, there was 545 reports that were written by coroners or published by coroners. And this represents only 0.1% of all deaths, or just under 2% of all inquests. So the lessons that we're learning from these 500 or so reports is a very small proportion of the total number of deaths that we could be learning from. The tracker is also able to give insight into who actually complies with this regulation and this rule, this law of 56 days. And I'll share more about this 45% in a moment. So by law, it should be 100%. All organizations have a legal responsibility to respond to the coroner, but our research has shown that this just doesn't happen in most cases. So what is the tracker? Well, it's a data-driven learning and vigilance platform that automatically collects all of these published reports from the government website and turns them into useful information that can be used for research and analytics. It's a website that anyone can access. We'd been working on this project for 2 years before we actually published the website, and I'll share more about what made us do that. So I was writing a piece of code, and I was using the website sort of on my desktop for my PhD research. But during COVID, I realized that people don't have the skills to just go onto GitHub and access this information. So it was trying to put an interface in place to make this information more user friendly. So we've created a web scraper, a piece of program that goes on to the judiciary website, the government website. It cleans and processes now more than 5,000 reports. And that process allows us to produce real-time statistics and a database that contains over a decade of data. This is, we also update the sort of features of the website and the database very often. This is the most recent version of what we call the Regulation 28 Reports Tracker. This is just the regulation that is used for coroners to write these reports. And so here I've just provided an example of where we can type in Northwest Wales, and you can see the sort of status of the different reports. So there's 5 different categories that those reports can be. The first is pending, where the report is not yet due for a response by that organization. Where there is a response available, so that's completed. There is an overdue option, so those reports are that sort of 60% that don't yet have a response due or a response provided. Partial is where you might have multiple organizations who received the report, but only sort of half or a proportion of those organizations have responded. And then unfortunately, as we know with many data projects, there's some reports that just have no data available. So we're not able to actually determine who received that report. So that's sort of the no data or the no sent to category. This database and our analytics are automated, so they're updated every Sunday evening at 5 p.m. The code automatically runs and it automatically updates everything on the website. It was a task that I used to do manually, but thanks to working with some computer scientists in Oxford, we were able to automate that process. So that allows us to provide real-time insights into the trends, geographical and coronial variations, and that issue around the responding to coroners with actions that organizations have taken to prevent future deaths. So now I'll just share what some of those analytics look like. So this is the trends over time. So at the moment, we're the only organization, if we can even call ourselves that, but the only place that you can actually go on and see statistics over time in terms of coroner reports. So in real time, we know in 2024 so far, 213 of these coroner reports have been published. We can also look at who's actually writing these reports. And this is often a controversial slide because coroners think it's a leaderboard, which it's absolutely not. It's just showing you that this is the data that we have, and we can now actually see what coroners are writing what reports, where they're writing those reports. And this sort of the data that we've pulled from comparing coroners is that a very large proportion. So these are the top 30 coroners. These top 30 coroners write 2/3 of all reports. So there's some very, very busy coroners writing many, many reports, and there's some coroners writing, or most coroners never actually write these reports. So it shows this huge variation that occurs in the practices of coroners. We can also obviously do that geographically. One thing we haven't yet done, so our geographical map shows us that the areas that write the most reports are in Greater Manchester South and Inner North London. But what we really want to do is start linking this data. So where we can link this to mortality data to really see, is it that we have hotspots of preventable deaths occurring in these regions, or is it just because the coroners are writing more reports in those regions? So there's a lot more epidemiological analyses that is needed to be done. But I should have said at the start, none of the work that we've done to date has been funded. So this is completely voluntary, and I self-fund all the computer program support that underpins the Preventable Deaths Tracker. So the government or no other organizations financially support any of the analytics that we provide. And this is relating to sort of the responding to coroners and the organizations who respond. So here we just look at trends over time. So you see the more recent reports are those blue ones, which are the pending ones. They're within 56 days and not yet requiring a response. But as you can see over time, sort of early on the 2013, 14 and 15 years, there's quite a few reports there that don't have data available. And the data does start to improve from 2016 onwards. But again, we've got a lot of red and a lot of yellow when all of that should really be green. And this is sort of an exciting part of the impact of the tracker so far. So this is looking at the response rate of that 45% that I mentioned earlier. So in December of 2023, I got permission from the chief coroner to offer a voluntary audit to coroners where coroners could write to me and I would give them a output of their data to say, these are the number of reports and these are the number of responses that are publicly available. Once I did that audit with those coroners who participated in that, we saw this big increase, which doesn't seem big in other worlds, but that sort of 10-11% increase from December to now we're seeing 45% is a huge sort of achievement in the world of data from coroners. So we are seeing a positive sort of change when we start sharing these sort of data platforms with coroners. It's just a matter of there's a lot more work that needs to be done to get that to 100%. This is a sort of new element of the tracker that we haven't yet published. We have lots and lots of projects that we're working on offline that aren't yet publicly available. And here, this is where we are able to look at who actually receives these reports and if they respond based on based on the individual organization's name. So up the top, we have the 3 most common recipients who receive that are healthcare related as expected. So Department of Health and Social Care, NHS England, and then the CQC, which is a sort of regulatory, which regulates hospital trusts here in England. And then we move to sort of prisons, justice, home office, transport. So a focus on healthcare, but this data is sort of cross-cutting. It looks at transport related issues, education related issues, healthcare, obviously, policing, but it's such a sort of cross-cutting tool in terms of who's responsible and who can actually take action to prevent deaths occurring in the future. So in addition to providing the sort of data, the trends, these sort of statistics, we most importantly conduct research because yes, we're based at Oxford and we do research, but we also provide alerts and sort of updates around sort of trends just in generally to respond to sort of government policy around sort of what deaths are occurring. And this sort of research is made possible because we use reproducible methods. We've done this many, many times, and we've created a sort of research recipe that can be replicated over and over again. So we've got 5 years of experience doing this research on these reports. So I wanted to share an example of one of these research projects, which was really the catalyst for why we published the website itself, rather than keeping it as just a GitHub repository. So back in COVID times, it was sort of 2020, I was doing writing the final chapter of my PhD, which was looking at preventable deaths involving opioids, so strong pain medicines, and I was just interested in those deaths. But as I went through the database, I started seeing some interesting cases that were coming through. And this was a case from the very start of the tracker or of the database in 2013, when a 30-year-old woman who was sort of in a mental health facility, and she had intentionally consumed alcohol-based hand sanitizer. And in this report from the coroner, they raised very valid concerns regarding sort of the accessibility of the hand sanitizer gel, and sent it to these organizations to take action so that this death didn't occur again. 2 years later, identified a very similar case in 2015. And this was in an elderly man who had suspected Alzheimer or dementia. He was in the hospital for confusion. He had a long period of confusion, so they were not sure if it was Alzheimer's or dementia yet. But this was a tertiary hospital, and in this tertiary hospital, this man accidentally consumed the hand sanitizer at the foot of his bed. So if the lessons had been learnt from that case in 2013, while that death may not have been preventable, those lessons just weren't translated at a national level. So when that case occurred, there was no mechanism or signal in place to then get all hospitals across the country to change their hand sanitizer access from being all around the hospital to being in a locked dispensary. And the coroner again raised very similar concerns in the 2015 case. So I was reading these cases in the middle of lockdown where there was hand sanitizer everywhere, and wrote this piece that we published in the British Medical Journal, and went on to the BBC and spoke about this in length, because there was 3 at-risk groups: children and young people that may have hand sanitizer around the house or in daycare facilities who may accidentally consume the hand sanitizer. We have those that may have substance abuse or misuse disorders, particularly around alcohol, if that was difficult to get access to during the pandemic. And then we have those in care homes and sort of elderly people in our lives and in care homes that may accidentally consume that hand sanitizer as well. So this was sort of a huge issue during COVID, and at the same time we had Donald Trump telling everyone to drink all sorts of things. So it was a sort of case that, wouldn't have been picked up if we hadn't have created the tracker, and if no one was responsible for actually going through these reports. So this is sort of what stimulated us to publish a website where we could make this information more usable. I won't go into all the other cases and other research that we've done to date, but I'll just sort of share some examples. All of the studies that we've published are on our website. So we've also used the database to look at cardiovascular disease and anticoagulant medicines. We've done a big case series looking at all deaths that report medicines. This is sort of one of our biggest studies, and this found that 1 in every 5 reports involve a medicine. So a huge, lots of lessons to be learned for drug safety from coroner reports. We've also looked at falls, which is another sort of really sort of important area in terms of elderly populations as well. We've also looked at deaths involving sepsis, and there's been a big case here particularly in England around Martha's Law. So we did this, we actually started this before Martha's Law or Martha's Rule came into effect, and we did a subgroup analysis of these sepsis deaths of those cases where they involve children, and sort of the misdiagnosis of sepsis in children. We've also looked at opioids, which, as I said, this was sort of our founding piece of research, the first sort of research study, and why we sort of set out to collect this information. And finally, we used the database to look at deaths during COVID, during the COVID pandemic. This only looked at half of the pandemic, so we're in the process of updating this research at the moment. But these are sort of just a taste of what we've done. We also use the database to look at changes in policy. So not formal research studies, but where we go and look at, okay, the government last year in November, they updated their Dangerous Drugs Act to make Substance Misuse Act to make nitric oxide sort of illegal for recreational use. And so I did an analysis of our database to look at how many deaths had involved nitric oxide. And the sort of concern raised here is that there are many other gases that could also be used as a result of restricting access to a single product. And this is what we find in the world of opioids, where when you restrict access to something, if you don't have public health measures in place to actually support people who use these medicines or who use these gases, then there's going to be a sort of net negative effect of there will always be other substances that can be abused. We've also used it to look at the Dangerous Dog Act. When last year we had England and Wales specifically changed the regulations regarding XL bullies. So the key learning from this work is that if you just rely on statistics from the ONS, which they do an incredible job. This is not to say that there's any sort of negative aspect to their statistics, but because of ICD-10 codes, ICD-11 codes, which are an international coding system, you can't get nuanced information from that data. So the data from ONS on dog-related deaths is that they combine those where a dog attacked a person and they died, as well as those where there was a dog bite that led to an infection in a hospital. So there's two really different types of deaths and really different learnings, but the government considered that evidence and that data as a sort of single data point. So coroner reports allow us to go into much more detail around the breed of the dog, around sort of where these deaths occurred, what actually happened, and what sort of, was there an actual dog attack, or was this a dog bite by any dog that led to an infection and a death in a hospital? So that's sort of the nuanced information that this database can give us. And then we also, while most of the cases I just shared were very healthcare related, we also look at non-healthcare related deaths, an example just being cyclist related deaths as well. And there's a lot of discussion going on about cyclists, dangerous deaths from cyclists at the moment. We also work with journalists, so we get into lots of journalists get in contact. This is a bit of work that we did with the Times, and most importantly, most recently in February, I was in Parliament giving evidence from the tracker to this Justice Select Committee, which is doing a follow-up inquiry into the coroner service in England and Wales. So that report from the committee will be out in July or this summer sometime. So we're hoping that there's some positive that come and some actual change that comes to the coroner service following the publication of that report. But as I said, we work with journalists. We also get commissioned by law firms and other organizations to provide analyses on different types of deaths. So as my role at Oxford, I'm employed to sort of teach the next generation of clinicians. So I teach in the medical school, I teach evidence-based medicine and various different types of research methods. And so many of the projects that I've shared today have been driven from medical students. And I've supported them to do their theses and different aspects of research that they're interested in. And so the thing that coroners like, it's a nice thing for them to know, is that this information and this data is actually being used to educate the next generation of doctors. And they often say to me, Georgia, I really don't want to be a doctor listed in one of these coroner reports. So they're also a great educational tool, as well as being a data tool. And finally, I said earlier, but the tracker can be commissioned to conduct bespoke analyses of PFDs. And we can also, you can also subscribe to receive monthly or quarterly subscriptions for sort of tailored content. So if you're an organization that's interested in medicines, we can provide tailored content on medicine-related deaths or transport-related deaths or education-related deaths, and the list goes on. So there's lots of sort of work that we do around providing this data in a real, a nice analyzed way that's much more digestible than what you receive on the judiciary website. I also run a Substack, so a newsletter that we try and send out once a fortnight, a sort of update of any sort of news that's occurring in the area around coroners and deaths, as well as any sort of bespoke or unique analyses that we conduct in-house. I thought I'd end on sort of a more positive note and maybe more relevant for those that are in other parts of the world. But despite this sort of system around that I showed before with that triangle around, these reports are being sent to coroners and, we're hoping that action is taken, but there's actually no one there to see if action is taken and if responses get made. I wanted to share a small insight into my home country of Australia, who has been running a national database of all inquest data for over 20 years. So in Australia and New Zealand, they have a database called the NCIS. And this NCIS database stands for National Coronial Information System. And that NCIS database collects data. So I'm only looking at that small end of the triangle, which is just about 460 deaths a year. This NCIS includes data from every single inquest that occurs every year. And that national database is analysed by an independent research unit called the Coronial Prevention Unit. And together, these two things allow there to be a system where you're constantly learning from deaths. So they don't have a PFD system. They don't have a system where coroners write reports, because there is always this learning that's occurring from deaths that occur. And this NCIS database is used by every government department when they're creating a new policy. They'll analyze the data from that information, and there's sort of signal detection that goes on within this coronial prevention unit to try and constantly inform the government the most up-to-date trends around deaths that are occurring across the country. So this is the ideal system. It's not a perfect system, but it is the ideal system, is what I'm advising the current government at the moment about how we can actually improve how we learn lessons from all inquests, from all those deaths where there's been a sort of unnatural, unexpected, sudden or violent death. And I will leave it there, but to say thank you very much for having me. If you're interested in learning more about our work and staying up to date about the new sort of aspects of our work, you can subscribe to our newsletter, and I'd be very happy to answer any questions.
Thank you very much, Georgia. That was super interesting and kind of really interesting to see all of the different projects and kind of insights you've been able to pull out from the tracker. We've got quite a lot of questions coming through, so I'll just get straight to them if that's all right with you. The first, or the top voted question which has come through, is from Sarah Swift from the Scottish Parliament, and she's asking, are there any plans to expand the tracker to include data from Scotland?
So I would love to include data from Scotland, but I should have said, I did sort of allude to it, but we have absolutely no funding. So we are not resourced at all. So I'm employed by Oxford 3 days a week to teach. And then my other 2 days is sort of freelance consultancy work. So if there is funding to support that, absolutely, it's something that we could definitely do. But at the moment, none of the work that we've done to date has been funded.
I know in the Data Lab unit, we've got quite a large public sector audience. So if anybody is interested in speaking to Georgia about how we might be able to get Scottish data involved, definitely to get in touch. We've also got another question, which is kind of similar or relevant, I guess, is if you were to get data from Scotland or Northern Ireland involved in the tracker, what would the steps, apart from funding, what other steps would there be to kind of get that started?
Yeah, definitely. So I don't know what data is available. So that's what I've sort of over the last 5 years has really started to have to learn a lot about. Most of the time, this data is collected locally in individual coroner offices, and it's not shared. So the last year, I've been going around educating coroners in England and Wales about data and about what can actually be done with that. So it would really just depend on, the first step would be to understand how that data is kept, what structures it kept in, is it actually even kept in data? Because at the moment, most coroner systems are kept in sort of paper files type systems. So is turning the paper into data is usually the first step. So it'd be sort of exploratory to see how the data is actually kept. Is it even kept as data? And then from there, you'd need to build something from that.
I guess, like you said at the beginning, bringing it through from a medieval system to the 21st century. So the next question we've got here is, could you give some examples of the types of organisations who would typically receive the PFD reports?
Yeah, definitely. So I had a slide on this, which was that new Regulation 29 tracker that we're bringing in. So the organisation that receives the most reports, unsurprisingly, is the Department for Health and Social Care, followed by NHS England and the CQC, which is the sort of regulatory body of trusts in England. So they're the sort of big healthcare organisations. But that list of organisations who receive reports, there's 1,800. So a huge number of organizations, mostly public organizations, but also lots of private organizations. So it's much more difficult to get data from private organizations. So yeah, a huge variety, like a massive variety of different organizations that receive these reports. If you think of any possible location that someone could die, or any possible location where an organization might be involved in a death, it's a huge list of organizations.
And related, Elizabeth Hughes asking, why are the returns of these PFDs so low, and are there any legal penalties if organisations don't respond to them?
Yeah, so the reason why they're so low, we don't have robust evidence on that. But what I would say is the first is there is no one responsible in the country for looking to see if people actually respond. So once the coroner sends the report to that organization, they have a legal requirement to respond, but there is no single person or organization who is allowed to follow up and ask for a response and ask for proof of the actions that they're meant to take. So there's just no oversight whatsoever. So that's why they can just get away with not responding. And then the second bit about legal penalty. So I was asked this in Parliament when I was giving evidence to the Justice Select Committee, and they asked, what do you think about sanctions? And, should we bring in sanctions to start sort of maybe fining individuals or organizations that don't respond? And my response to that was, there isn't good enough evidence. I teach evidence-based medicine, so everything has to have evidence. There isn't good enough evidence out there to say that giving someone a fine would increase response rates. It actually probably make it a more it'd make the system a lot less likely to learn from these deaths. So my response to that is that if we had a national system like Australia, where data was anonymously collected in a national database, and that was just used routinely, there would be no need for a PFD and no need for any sort of legal anyone being scared that there'll be some sort of legal ramifications. It would make it much so that we're all going to learn from these deaths and we don't want them to happen again, rather than I'm going to get fined if I don't respond, and sort of trying to cover up mistakes that may have been made.
We're trying to avoid making it become a tick box exercise that people feel they have to do.
Exactly.
So the next question is, do you or have you come across any issues related to data privacy when you were building the tracker? I guess you use a lot of publicly accessible data, but are there any issues with privacy or data protection?
Yeah, really good question. So this is something I should have probably answered in more detail in my talk, and was sort of one of the objectives. Is the interesting thing about GDPR rules. So GDPR is the rules that we have here in the UK relating to data protection and particularly confidentiality. So I come from a field in healthcare where patient confidentiality is the most important aspect in sort of any bit of work that we do in terms of data. But unfortunately, when you die, you're no longer considered a person. So none of these regulations that were set up to protect us apply to anyone that is a deceased person. So this information is completely published online. It's openly available. And yes, anyone can go and read this information. It's something that I think most of us as living humans don't realize, that once we die, our data is then up for anyone to just use. So I haven't had any sort of legal issues in terms of the privacy aspect, because there are no laws that apply to deceased people. But I have occasionally had emails from families who have asked for sort of bits of information to be removed. But that has more so that's an issue for the chief coroner and the chief coroner's office to deal with, because I replicate exactly the data that's available from the chief coroner's office. So I legally can't do anything about that. If the chief coroner's office has put it up there, then I use that data. But yeah, it is something that you have to be sort of sensitive about. It is sensitive information. So it's something that we're very aware of, but there's been no issues as such.
It's really interesting. I hadn't realised how the kind of GDPR and data privacy laws change once you die. Yeah, really interesting. So the next question is, have you had any insight into why the government won't fund the project? And the same question, do you have any data on who's been using the tracker? I guess the person is kind of suggesting, if the tracker is beneficial to the government and to the public sector, why are they not funding it?
Yeah, this is $1 million question. And so yes, I've spent the last 5 years, as I said, talking to so many different organizations. I've met the MOJ, Ministry for Justice, met with the Chief Coroner's Office many times. I actively work closely with the Chief Coroner's Office, and many public organizations, NHS England, CQC, HSSIB. I've also actively been applying for grants. As a researcher, we can apply for public grants as well. There's been no clear reason why they won't fund it. I think the reason is a few reasons. One is a political reason. So if they start no research around coroners has ever really been funded. It's such an under-researched area. And I think there is this fear around litigation and what might happen if we start looking into these deaths. So I think there's a political hesitancy to do anything about it because nothing's been done before. So let's just not open a can of worms and start, looking into this, which is a real shame. Evidence on who's using it, I often am forwarded emails from people that might have contacted the chief coroner's office or government organizations, and they'll actually send them my tracker when people ask for information, and I'm like, oh my gosh. But in addition to that, we use Google Analytics, so we know last year, for example, we had over 84,000 users just in 1 year, which is more than any research paper, or sort of, it's a huge volume of unique people that are accessing our data. And more than 300 people downloaded the database. So, there's hundreds of people using it, as well as I do commissioned work. So that's sort of me actively working with organizations, and that can be from bereaved families to the media, to charities, to law firms, lots and lots of different, it's got such widespread use. It's just so frustrating that we don't have infrastructure funding, because there's so much I need to build onto the website to make it much more user-friendly, have a dashboard, have it much more interactive so you can go on there and collect the data that you need. So there's lots of work to be done, but we just don't have funding to build those aspects.
I think Terry Francis in the chat summed it up quite well, saying it's an ostrich head in the sand method from the government.
Exactly.
So Stuart's asking about kind of more around the technical aspects of the database. It looks like you're using Salesforce for the report, and it's impressive that you're self-funding this. Is that correct? You're using Salesforce, or could you give us a bit more information about the kind of technical build of the platform?
Yeah, sure. It's really basic. I feel embarrassed saying how basic it is to a room of probably expert computer scientists, but we use Python. We use like really simple programming that's run through GitHub. That it's literally some Python, a few different open source libraries, and GitHub is how we produce it. And then the website itself is built through WordPress, but it's super basic, really basic platforms and infrastructure. Again, we would love to have a proper, bespoke sort of structure behind it. So if you would be willing to introduce to Salesforce, my email is on my website, is on the tracker website. So very happy to be introduced to them. But any sort of, I contacted sort of Microsoft, Google, those sort of organizations as well, to see if they would be corporate social responsibility around sort of, how data can be used for social good. So very happy for anyone to reach out if they can share resources or have any sort of organizations that could provide support. So it is very basic.
I don't think there's any shame in having a simple platform that works. I think anybody would agree that if it does the job, then it doesn't have to be any more complicated than that. But yeah, Stuart, if you can make any introductions, please do get in touch. So Pragya has asked, is the data currently being used? Well, I think you maybe actually answered this since the question was asked, but is the data currently being used for further research to identify patterns in certain behaviors, for example, suicides in healthcare or academia? I think you maybe touched on some of the examples at the end of your presentation there.
Yeah, I don't think I put up our suicide project. So we have done a suicide project that's been, if you go into our the research tab on our website, that's the first study that will come up there. That particular project looked at suicides involving medicines, but it's very simple to, focus that on suicides in healthcare or suicides in academia. The only sort of caveat I have to say is that it's only the information that's being reported by the coroner. So sometimes, we have gaps in our knowledge about, we might know that it's a suicide, but we might not know the full extent of information around suicide or self-inflicted deaths. And that's another regulatory barrier in terms of privacy, because there are some laws around, or not some laws, but some guidance around what information you should and shouldn't share about suicides to reduce sort of what's called copycat suicides. But yes, we have done work into suicides, and it is an area that is, super important that we want to do explore more. So there is an initial report there that you can have a look, but happy for you to reach out to ask further questions.
Brilliant, thank you. I see Rick's also saying simple is better than complex, the Zen of Python. So Ben Proctor's asking, do you have any sense about whether coroners who write few PFD reports have fewer relevant deaths, or are they missing the PFD opportunity?
Great question. This is $1 million question, which is what I was asked in Parliament in the Justice Select Committee. So normally to answer that, I'd like to have really robust data around, we've done a survey of the 600 coroners and they can tell us about their practices, and then we can actually start understanding, A, from the coroner's perspective, and B, from mortality data, whether, what ONS tells us about how many deaths occurring in Manchester compared to Kent. And, is there a real data reason why we're getting more or less PFDs written? My sense around that is that the sort of, I think, underlying issue is, one, resources. Coroners have we don't have a national coroner system. So each area has a senior coroner and maybe an area coroner or an assistant coroner. So resourcing is an issue. And also there is this lack of consistency in what is considered the right threshold for when a report or a PFD report will be written. So some coroners are like, anytime they interpret the law as if a death, so say you have an individual death in a specific hospital, that hospital will likely come to the inquest and say, our hospital's fixed everything, there's nothing to see here. So the coroner feels like they can't write a report, and that's often what happens, and that's why we get so few. But actually, if you read what the legislation actually says, it says if there's any potential future deaths, any sort of future deaths that could occur. So what should happen really, if the law's interpreted correctly, at a national level, that report doesn't go to that individual hospital because they've fixed the problem, but you send that to the national healthcare system, so the Department of Health and Social Care, NHS England, NHS Wales, and say, hey, this occurred in this hospital, they've resolved it by this way, but this is going to be a national problem. So that's what should have happened in the hand sanitizer case. There should be a national learning. So it's often considered, the sort of lessons are considered as a local rather than a national learning. So I think there's a sort of few aspects occurring as to why so few are written.
Great, thank you. So another question here, we've got time for maybe the last three here. Does the tracker make use of artificial intelligence technologies to identify further patterns and classifications in the data to make it more useful?
Great question. So the answer to this is sort of, not yet. So we had a computer scientist join us last year, and we were trialing some software machine learning. We use sort of basic AI, like algorithm. We use AI to sort of in the back end to help with our automation and the sort of tool infrastructure part. But in terms of actually looking at patterns, classifying deaths, all of that, no. It's sort of where we do want to go in the future when we have resources and time to sit and actually work full time on this project, which is the goal.
I guess another call to anybody here, if you're interested in helping, then get in touch with Georgia. Okay, last two questions from Elizabeth. Does the health and safety executive have a view on those who do not respond? You maybe kind of answered that already. Yeah, sorry, we'll go for that one first.
Yeah, so really interesting about the health and safety executive. So they're the regulators of sort of industry workplaces, for those that aren't familiar. But I recently actually sent them an FOI to ask about. So they've received quite a number. As an organization themselves, they receive quite a large number of PFDs. And their recent response was that they don't know what their data looks like. So that I've sort of pushed back to say, this is a legal requirement. Can you actually confirm that you don't have any data on this? So if anyone is from HSE, I'd be really interested to hear your thoughts. Do reach out. But I don't think they get involved in PFD reports and responses to individual workplaces, not that I'm aware of.
Cool. And then last question, when you gave evidence at the Justice Select Committee, did you get a sense of if there was a change in government, do you think there'd be more interest in funding the project as a kind of, a party aspect, or do you think there'd be changes?
Yeah, so I have to remain optimistic that yes, but I did go and meet straight after I gave evidence to the Justice Select Committee. I did go and meet one-to-one, face-to-face to the Minister for Justice, who does hold the sort of money strings, and the sort of response, the sort of overarching response after that meeting was that they're going to wait for the Justice Select Committee's report. So if the Justice Select Committee's report encourages such funding to be given for infrastructure for such a data model, then I hope that the current government would give funding, but I've remained very skeptical. But as soon as we know if there is a change of political party or a change even of leadership within the MOJ, I will be trying my best to organize another meeting and have further discussions. So I don't know, but I think the Justice Select Committee's report that will come out this summer will definitely help give evidence and sort of motivation to start funding this sort of data.
Brilliant. I've just realised there's quite a lot in the chat at the moment as well, and I think these are in relation to integrating Scottish data into the tracker. So someone's suggesting the Crown Office and the Prosecutor Fiscal might be good first point of contact for data in Scotland. And Terry is also saying that he would be happy to help in any way. Terry, Francis would like to help in any way. So yeah, Terry, please get in touch with Georgia. So that is just through all of the questions for today. So all that's left for me to say thank you very much for joining us. And as you said, if anybody would like to get in touch, your email is on your website, or I guess they could get in touch with you through the Data Lab community as well. Just get in touch, and if you need me to introduce you to anybody, let me know. But thanks again, and we'll see you all next time.
Great. Thanks, everyone.
Bye bye.